welcome to another edition of CrossTalk. My name is Kevin Tocci, and I will be your host for the next 30 minutes. Now, as you know, this is a community show, but from time to time, we do have folks that we have come in, especially if it's a state race, folks who are looking for your vote. Maybe it might be a community event. Joining us today, we have a gentleman who is looking for your vote for governor. We have Mr. Joe Avellone joining us. Sir, how are you?
Kevin, thank you very much. It's my pleasure to be here.
Now, if I was correct, I would say Dr. Joe Avellone.
That's true.
Or I could say Joe Avellone III. But we could just kind of keep it simple. Give us a little bit of a bio on yourself.
Well, thanks. Joe would be fine. Well, thank you. It's a pleasure to be here. I have a long career in healthcare. I went into medicine 40 years ago now because I wanted to help people. I went to Harvard Medical School and I became a surgeon at Brigham and Women's Hospital. And then I practiced surgery for some time and really learned a lot about the struggles of people's lives during that time. Then I thought I could have a bigger impact on people if I was a leader and a manager in our health system, and really that's what I've spent the last 30 years doing. So I was the Chief Operating Officer of Blue Cross and Blue Shield back in the 90s. That's when we modernized Blue Cross and controlled healthcare costs. And then I was an entrepreneur. I ran my own company that used the internet in its early days to try and shorten the time for new drugs to be developed so they could get to patients and doctors earlier. And then for the last 7 years, I've been running a very large global division of an international medical research company called ParExcel. It's based here in Waltham, in Massachusetts. We have 15,000 employees around the world in 50 countries and about 3,000 here in Massachusetts. Beyond that, I've always been interested in public service. I was a selectman in my town in Wellesley for 6 years. Met my wife, Sandy, who's a Worcester resident. We've raised 3 wonderful kids, and I believe that I have the skills that I think can really make an impact in the corner office for the next governor based on what we're really facing as a Commonwealth, and really that's why I'm running.
How important do you feel municipal experience, having experience on the municipal level, is for somebody who wants to matriculate to be our next governor?
You know, I think it's very important. The cities and towns, the government here for cities and towns is very important in our state. We have a more limited county government. Mm-hmm. So it was actually a great experience for me. I think some of the keys are that I dealt with public budgets and the stresses and strains that goes with that. I also have been through collective bargaining with public unions, fire and police unions 2 different times over the 6 years that I was a selectman. And this has been a very important experience for me. In fact, I'm the only candidate that has had collective bargaining experience with public unions.
So see, and again, I feel that's not to dissuade anybody else who may be running for governor, Democrat or Republican, but I think you get to feel the ache. You get a sense of what it's like to have to take what you're given, not only what you're going to do for the general government side, but also take care of your school if you have a school district, depending on what you have, and be able to kind of get by and also go through things like unfunded mandates.
Absolutely. So all that relationship between the cities and towns in the state, I'm very familiar with, having been on the town side of it. And I also, you can't underestimate how important serving the people is in public office. The people care a lot about those services, especially public safety and fire services, and making sure that you can meet their needs and still make the budget is, I think, was a good experience for me, for sure.
What would you feel are the top issues, and what are Joe's top issues?
Well, I'd say
that's a 2-part question.
It is. The top issue, as I see it, is jobs. We really need thousands of jobs in our Commonwealth, new jobs, all through the Commonwealth, and especially in our so-called gateway cities, the older cities that are in decline. As we come out of this very, very difficult recession, a lot of these older cities are not really just going to bounce back. Right. The old industries are gone, and we really have to replace them by bringing new industries here to create thousands of new jobs. And really, I've spent my 30 years now creating literally thousands of jobs, and I think I know what it's going to take. And it's definitely going to have to be the major focus for the next governor. So jobs, I think, is absolutely critical, the #1 issue. And it's middle-class jobs, so that essentially people have an opportunity to grow and raise families and to grow and have fulfilling lives here. And we can't do that without bringing a lot of new kinds of businesses here. And I think I will lead that effort as governor. Hand in hand with that is improving education. And really that starts with K through 12. So I have been very, I think, bold in my K through 12 education plan, and I'm taking on closing the achievement gap. Although we have a good public education generally in the state, as we know, as compared to other states, there still are too many places where the achievement gap is too large, where the poor performing schools are really not serving our kids. And then I would finally say that we need to use our state and community college system and vocational schools a lot more proactively to bring these new businesses here. It's my experience running a large global business that jobs go where the workforce is. If we have the trained work skills here, if we have the right kind of work skills for our young people, then we can bring new businesses and therefore lots of jobs here. This has been my experience running a global business. In my case, we even had to create our own program with Salem State in order to create the kind of work skills that we needed for our business, which is in the life sciences business. And then we hire those students into our company. This is what the state really has to take the lead in doing in lots of places in our Commonwealth.
What can the state do in order to, I'm a proponent of, I don't think that government can create jobs, but I think the government can do enough to make sure that it does not get in the way of job creation, whether it's fees. We know recently Governor Deval Patrick and also President Barack Obama both want to institute a hike in the minimum wage.
Yeah.
Some folks call this we could lose jobs. Some folks think that this is, it's a timely thing. Give me your thoughts.
Well, I agree with you that the state's role, as far as jobs, is not to create the jobs themselves. We are a private economy,
growth.
Yeah, but it's to create the right environment, and so part of it is the right work skills. But the rest of it is, as you said, trying to make sure that the taxes are affordable for our citizens and our businesses, trying to keep healthcare costs, which is something that I bring to the table, at an affordable level for our businesses, trying to keep the regulations at a minimum. These are the things that I think will help the Main Street businesses expand. I know, having spent some time in Brockton, that I found a couple of wonderful young new entrepreneurs that really have started up businesses, one in the computer repair business and another now in a cell phone business. And they've done that just from scratch, but they can only do that if the environment's right for them. And I think this is a role for the state as well. In fact, I'm actually proposing an innovation center idea for my economic development plan that we would establish some small business incubators around the state, including, for example, Brockton, where we could provide the facility, and some of these new entrepreneurs, these young people that can start businesses, have shared facility and an ability to start, and maybe even people from a local university that we would tie in that would help them with business plans and things. So that's what I think we can do to help Main Street businesses and also bring these larger new businesses to the area.
Okay. Other than the minimum wage hike, I know that there's been a conversation in regards to sick days, maybe doing something with the unemployment insurance.
Yep.
Give me your thoughts on
Sure.
either of those either being introduced or voted on by the lawmakers up on Beacon Hill, and as far as unemployment being, that the insurance being fixed.
Yeah. Well, first of all, on the minimum wage, I do support the minimum wage. I believe that we can't have people working full-time in poverty, and that is the case today. And a lot of it is with big companies. They work in large companies and yet still are living in poverty and require assistance from the state. And that means these big companies are just increasing their share price on the backs of working people, and I don't think that's correct. So I do think that we need to raise the minimum wage. It hasn't been raised for a long time. I think these other, the issue with sick days is a nice thing, and I would encourage companies to do it, but I don't think the state should mandate it. At least I would want to make very clear that it isn't a burden on small businesses, and I have a feeling it probably is. So it seems to me that's a good idea, but maybe not something the state should be mandating, because that could interfere with the ability to hire the next person, and what we need is more jobs. I do think that the unemployment insurance system can be improved. And I think it could be improved by the proposal that's in the legislature today, which has to do with how it rates. It sets the rates. If the marketplace sets the rates, it is allowed to based on the prior experience. If people have been a good employer, they don't have much turnover, then their rates are lower. Right. then I think that's a good way to have reform. So the good employers, I think, benefit with better rates. And I think that's probably the way that reform ought to go.
Okay. Talk to me. You quite the knowledge when it comes to health care. It's obvious.
Thank you.
We look at what's going on with national health care and see how it's being implemented by a state-by-state case. Massachusetts, of course, being probably the birthplace of health care for one and all. We see that it's been having problems with the website. It was doing fine when we were standalone as a state. Do you feel that it's going to be something that we're going to eventually be able to get under wraps as being a part of a national health care? Or do you feel that it might end up being where it's a state-by-state thing eventually?
A little in between, so a little bit more state by state. I think we have a system that works, that we put in place 7 years ago, and I think we should be very proud of it. We really are the only state that has everybody insured, and I think that's a very important thing. It gets better care for people, and also just the whole ability to care for people is better if everybody has access to care. So I think that's an important thing. We should be very proud of it. What I don't think we should do is, somewhat what you were alluding to, is have the federal government put new rules on top of the system we've already developed here.
Layer.
Yeah, that just makes it complicated. That is actually what is causing some of the problems with the website. And I, as governor, would petition for a permanent exemption from the new rules from the Affordable Care Act on top of the system we already have. And the reason is we already have the result that everybody's looking for. We have everybody insured. And I think as the federal act, the Affordable Care Act, continues to roll out among the states, there are going to be variations in how it would actually work in each state, because the health care systems are very different, the population is very different from state to state, and I think ultimately the health care insurance system is going to also be somewhat different. So I'm going to petition for a permanent exemption because I think we've already got the result that actually the federal law was looking for.
Okay. Let's talk a little transportation. And we know that this governor was a big proponent in one economic arm of transportation, the South Coast Rail. So he wanted to kind of help the folks down in the New Bedford Fall River area. We know that he's also been trying to do his best to have some kind of infrastructure for repairing roads and bridges. Give me your thoughts on what you will do in regards to keeping that ball moving forward with transportation and anything that you might add to it.
Well, it is a huge issue for us. It also it's necessary not only for our quality of life, but also for the new economy we want to build here. We won't be able to bring new businesses here based on these new industries unless we have an improved infrastructure. And we're way behind in our ability to build the new infrastructure because of the massive cost overruns of the big dig, which happened during the last Republican administration.
Saddled with it now still, yep.
Absolutely. And that has really hindered our abilities. But we have to move forward. We have to move forward and we have to essentially do it within our means. So I did agree with the increase in the gas tax that the legislature passed. That is a good down payment on getting started on some of our bigger initiatives in the state. I do think that the regional transit authorities, and I imagine that would be an issue here in this area, are important to build up, that the bus service from town to town is very important for, once again, quality of life and for our economy.
Sure.
I do think that the South Coast Rail ought to be built. I don't think we can have new businesses created in big ways in the southeast region of our state if we don't connect it to the rest of the state. And of course, there are other mass transit improvements that we have to have around the state. So ultimately, we are going to and should move forward on these infrastructure investments. The gas tax was a good first start. It may be that we'll have, and I think we should have a dedicated revenue stream, because otherwise it's too hard to fight in the general budget each year for these kinds of infrastructure improvements, and it'll be around the gas tax.
Are you somebody who's for it to be linked to CPI, where it's kind of it automatically triggers with inflation?
This is a very good question. Typically, I like to see the legislature revisiting taxes rather than have them tied to either cost of living increases or other kinds of indexes. I think it's important to vote on these things, and I think that's why the legislature and the governor should be held accountable each time, and so I wouldn't favor automatic indexing.
Okay. Being somebody who was an elected official, a selectman, you had to deal with Prop 2.5.
Yes.
Do you feel that Proposition 2.5 is something that it could remain in place, or is it something that could be tweaked down the road?
Well, it certainly has shaped our whole approach to how the state government operates.
Since 1980, yeah.
For a long, long time. So I guess I wouldn't be calling for a total overhaul. I do think we have to pay attention to the ramifications of it, however. It means that local aid is a very important aspect of the state government and how it deals with the towns. There's no way that the cities and towns can offer the services they need based on the limits placed on them by Prop 2.5. So I guess I'm not at this point advocating a total overhaul, but I do think we have to replace local aid. We've been cutting away, pulling back on local aid since the recession. Our system can't really tolerate that given Proposition 2.5. So I think I believe that if we're going to keep 2.5, and I'm not saying we should get rid of it, because I think it does keep a cap on a very regressive tax, which is the property tax. But that means that the state has to continue with its obligation to provide adequate local aid on top of it.
You kind of stole my thunder. That was my segue, was
Okay.
local aid, whether it's Chapter 70, Chapter 90 monies.
Right.
You know, if you are elected in November as governor, you know, you're going to be automatically putting a budget on the table by the end of January of
Yes.
2015. Talk to me about the importance of having that fine balance of being able to give to certain towns and help them with their financial infrastructure.
Yeah, absolutely. I mean, Chapter 70 and Chapter 90 are two important things. So just for your audience, the funds that go towards local infrastructure improvements, roads and highways, a lot of the roads and highways in a town or in the state are under town's responsibility, not the state. And yet some of the funds have to come from the state because of Proposition 2.5. And the state had been cutting back on those funds. Well, we can't do that. We have to replace those funds. We have to make sure that we continue to fund the roadway and transportation needs of the cities and towns so they can keep the roadways safe. So we have to go back to funding that at an appropriate level. And I think in this year's budget, it started to, but next year's budget, we have to continue that trend because it had been cut back in previous years. And the second is school aid, and the other thing that you mentioned. And that formula has to be revised because over time, healthcare costs in particular, special education needs have all changed. And I think the accuracy of that formula is now in question. So I will push hard to make sure we revisit that formula to create the right kind of formula that gives fairness in how we allocate funds for education back to the cities and towns. Overall, though, the general answer is we have to increase local aid as the economy is recovering. So this year, in this year's budget, it was a 5% increase in revenues, but we didn't have a 5% increase or anything like it in local aid. We need to keep pace with the recovery and build up the amount of local aid that we're returning to cities and towns.
I'm sure you've been paying attention, as all of us have been over the past couple of years. It seems as though there have been a number of problems with state agencies, whether it's the Department of Transitional Assistance, the Probation Department, most recently the Department of Children and Families, as there's a 5-year-old child from Fitchburg who is still missing, feared dead. And the head of that, Olga Roach, is kind of under fire at this time. The governor is under fire.
Yeah.
She's only been in office for 10 months. Give me your thoughts on seeing so many of these different issues popping up with state agencies. What's your thought?
Yeah. Well, first of all, it's tragic. I'm a father, and the idea that under the state care we might have lost a child who now might be dead is, a tragedy beyond describing. And also the potential that the patient in Bridgewater State Hospital was mistreated in an attempt to try and put restraints on him in a way that resulted in that person's death. These are tragedies, but ultimately these things come back to management. I mean, as a state, we do have responsibilities to care for some of our most vulnerable citizens, and certainly dealing with children from troubled families or dealing with people who have severe mental problems and could be harmful to themselves or others are two great examples. We have to have management systems where we have leadership and training and responsibility in place so that everybody acts the right way every time, and you can never have these kinds of tragedies happen. We fly airplanes. I was a surgeon. There's lots of parts of our society where people have to be very well trained, have to act the right way every time in order to keep from any harm occurring, well, the state government's got that responsibility too in some of these key areas. I think another part where I think I've been very disappointed is some of the things that have happened in our own public health department in recent years. We had the compounding pharmacy problem in which
Drug lab scandal, yep.
And the drug lab scandal itself. And both of those things, well, certainly the compounding pharmacy resulted in deaths around the country from drugs that were shipped out of a compounding pharmacy here. I think this means that we have to reinstill strong management culture in the state government. I've actually run very large organizations, being the COO of Blue Cross, or now running this very large global organization. I know what it takes to build teams, to keep people accountable, to create the right kind of measurements and the right kind of training systems so that things happen every time the right way. And that we have to bring that back to state government. I would say in the case of the DCF, we need a full and comprehensive review to make sure that we aren't going to lose other children, that we make sure that we know everything that has happened, so we understand if we have to change processes, change trainings, change caseloads, or perhaps the management, that we understand everything and then take very aggressive actions to make sure it doesn't happen again.
Okay, this is the part of the program. We're about two-thirds of the way through the show at this particular point in time. I want to give you an opportunity to kind of share maybe what you've been hearing from the folks out and around the Commonwealth. Other than jobs, what are some of the things that you're hearing from them that they want you to focus on if they vote for you come September and November?
Well, I'll tell you, I've been running for a year, and I've been in 130 cities and towns and over 400 events, and I've talked to thousands of people, and I can tell you that people don't think that politics as usual is really working for them. I don't think they believe that the state government is very responsive to middle class, to the needs of the middle class. I think they believe that the system is really tilted towards insiders and an insider view of the world that creates too much money involved in these races and not enough connectivity to the people, the people that are out there. And I think that's part of why we see such a large unenrolled population in our state. Over half of our citizens aren't enrolled in a political party. They don't really think that that kind of politics is working. So I believe this is the biggest issue, and actually I'm not a conventional politician. I'm coming from the outside. I think we should have people like me run for office who have been citizens and worked in the private sector and understand the everyday lives of people and can bring that to state government versus professional politicians. So the number one thing I think I've seen is a weariness around insider and politics as usual, and a willingness and interest in having something new and new experiences with our state government.
Any conversations in regards to the drug addiction problem that we have in this state, especially on the South Shore, which has an effect not only on the populace, but drugs it doesn't come from someone taking the drug, but it's to feed the need, which is crime related as well. Yeah,
this is a tragedy, and I have been hearing it all year around the state, and it's in lots and lots of places in our Commonwealth, not just the big cities, and certainly have certainly seen it on the South Shore as well. So I've actually proposed a very bold change. I've proposed an Office of Recovery at the state level, at the governor's level, which will, in my administration, move this problem away from criminal justice and putting drug offenders in jail and move it towards treatment, which is what they need. We are spending $46,000 a year incarcerating literally thousands of young people for minor drug offenses who have addiction problems, who actually need treatment. And we're not serving their needs. They're not getting better because they don't get the treatment. And ultimately, this is a self-defeating thing. So as the governor, with the Office of Recovery and with more drug courts, I am going to stop putting people in jail for these minor drug offenses and start making sure that they get adequate treatment. And I think this is going to be a big change. And I think I, as someone with a long-term healthcare background, can really remove the stigma of addiction, move it to the health side of how we deal with it, which is where it belongs, and move it away from a criminal justice issue.
We've got about 5 minutes left.
Okay.
Is there an issue that we haven't touched upon, but you really want to make sure you put your stamp on it in front of the folks who are watching right now?
Well, I think I've been really focused on the practical issues of the cities, in particular the older cities. And they are, as we've talked about, they are jobs, new jobs based on new job skills. I think it's very important that we use our community, state colleges, and vocational schools in a way that makes sure our young people have the new job skills. Then we can bring lots of new businesses here and new industries that I think will be what the 21st century Commonwealth is. The second thing is to improve the achievement gap. Every year we're leaving thousands of young people behind in a way that we as a Commonwealth cannot, should not do, and won't do in my administration. They either drop out of school in these poor performing schools, or even if they graduate, they aren't ready to take on a job in which they can support a family. That's not fair, and we can't do that anymore. The state needs to take an active role in making these schools better. And the third thing is the addiction problem that we just talked about. I think it's huge. It's very much time to make a shift towards treatment. It's all over. It's in lots of our families. And I think we have to face up to the problem and really deal with it directly, not pretend that we can take care of it by putting people in jail. So I think those are the things, those are the practical issues that will make our cities better and therefore our Commonwealth better. And then really that's been the focus of my campaign.
If you had an opportunity to look in that camera right there and say something to the voters in this area, what would you say to them?
Well, first of all, thank you. And it's been a great privilege to be running for this office. I've spent my life in healthcare and in the private sector, but what I've found is that this is a time where my background can really serve the needs of the Commonwealth. I am not a Beacon Hill politician, and this is really not a time for politics as usual. The next governor has to do two critical things. We have to create thousands of new jobs in our Commonwealth, and I've spent 30 years doing that. And we have to control our healthcare costs, which I have done in the past. I'm the only candidate that's done, in order to afford the things that we need to invest in as a Commonwealth, like education and workforce development, infrastructure, without raising taxes. So I think I am the person from the private sector who has the background that can do these things. And this is what the next governor needs to do. And I believe that I can make a big impact on our state for good. I certainly could use all of your help in doing so, though. And it's been my pleasure to be here today.
Now, if folks want to find out more about you other than watching this program, I'm sure you have a website. I
do, thank you, Kevin. It's AvellonForGovernor.com, and Avellone is Avellone for Governor.com. Would certainly invite everyone to go there, and please, follow our campaign along.
Well, I want to thank you so much for coming here.
Thank you very much, Kevin.
And chatting with us. We definitely wish you the best of luck. And I want to take a moment to tell the folks at home is, your voice can be heard by going to the ballots on September, I believe it's September 4th.
I believe so.
I believe it's September 4th. Yeah. I could be wrong, but it's in September.
It'd be the second Tuesday, I think, of the month.
Yeah, and in November, and make a difference. There are a lot of important races that are up for grabs this year, and your voice can be heard by casting a ballot. That's another Crosstalk, and for my friend here, Mr. Joe Avellone, have yourself a great day.
Thank you.